News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello and welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. We want to thank you for joining us. And right off the bat, I want to ask you to think about your own personal health and your family's health for a minute. And I'd like to ask yourself, how important is that to us? How important is our health? And then next, I'd like to ask you to think about healthcare quality and accessibility. How important is healthcare quality and accessibility to you? That's what we're going to be talking about in our show today, and we have a great guest. Our guest is Mike Weldon, who is the director of the state of Nevada's Department of Health and Human Services. Mike has served as the director of the Department of Health and Human Services for over 12 years. He was first appointed by Governor Kenny Gwinn in July of 2001 to that position and has been reappointed by Governor Jim Gibbons and Governor Brian Sandoval. Mike is a member of the governor's cabinet and is the longest-serving Department of Health and Human Services director. Mike is responsible for the oversight of the largest department in the state of Nevada, with a budget of $7.4 billion, which is 38% of the total state and federal funding. He has approximately 4,900 employees, which will be increasing to 5,400 employees by the end of the biennium, largely due to implementing the Medicaid mandate of the Affordable Health Care Act. Mike is responsible for programs which provide both public assistance and self-sufficiency. He oversees 6 divisions, including Aging and Disability Services, the Division of Child and Family Services, the Division of Healthcare Financing and Policy, the Division of Health, the Division of Mental Health and Developmental Services, and the Division of Welfare and Supportive Services. So, Mike, we are very grateful that you've taken time out of your busy schedule to be here with us today. And with the legislative session just starting a couple of days ago, Mike, the first thing I want to ask you is, what are you thinking about the way things are looking for health and the legislature this year?
Well, first, Tom, thank you very much for having me on. I appreciate the opportunity to talk with you. Okay. So yes, the legislature did get started on Monday. Actually, they started a couple weeks ago with some of our early presentations on our budgets, but they're off to a pretty quick start. How I see it shaping up, at least for the department, the big ticket, the big dollar items are going to be the Affordable Care Act and the Medicaid expansion. You won't see too many policy issues around that. I don't believe so anyway. Those are largely budgetary. There's a substantial amount of new money in the budget. You mentioned the $7.4 billion that the department oversees, that we're entrusted to oversee the taxpayers' money. That's about a $1.2 billion increase over the current biennium we are. And most of that money relates to the healthcare coverage expansion. So that will be a big topic in the money committees. In the policy committees, I think you'll see lots of mental health related legislation. As you know, there's been 3 or 4 national tragedies, some of them close to home, right here in northern Nevada, and some in southern Nevada. So there's a substantial amount of legislation that's already been drafted dealing with mental health care, not just the inpatient hospitalization stuff, but really how we go about our outpatient services and access to urgent care, making sure our emergency rooms, people aren't languishing in the emergency rooms where they're getting physical care, but they're not yet getting their mental care, their mental health care. And so that's going to be, I think, a substantial issue. So those are the big things I think that we're going to start off with.
Mike, would you mind fleshing that out a little bit when we talk about accessibility and quality? What changes are you hoping might show up in the daily life of a Nevadan as a result of this?
Well, let's start a little bit about mental health or behavioral health is where I would start. One of the things, particularly in southern Nevada, having access to urgent mental health care. Many times, something's happening in someone's life or in the community where they are engaged by law enforcement or medical professional or even their family, finding someone is out of control. And so the method now is it's a trip to an emergency room, and then they have to be cleared medically, and then they have to come into our behavioral health system. We're trying to circumvent, or if you will, sidetrack that emergency room process and get them directly into the healthcare so we can help people stabilize on medications and things like that. In the general healthcare arena, the biggest change is going to be, again, access to healthcare through one of two ways. And maybe I should spend just a minute talking about, there are about 605,000 uninsured Nevadans. Nevada has a 22.5% uninsured rate. And so the change is going to be that through the Medicaid expansion and implementation of the Silver State Health Insurance Exchange, we think we can cut the uninsured rate in half. Great. So from 22% to around 10 or 11%, and people will have access to health care either through the exchange or the Medicaid expansion.
Mike, that's some great news, and I want to follow up with you about that right after this brief break. Welcome back to New Skills for Living. You'll see up on your screen the website easeap.com. When you go to that website, you'll be able to see again this interview with Mike Wilden. You'll also see other interviews like with Dr. Stephen Hayes or Dr. Amy Kahn, other healthcare professionals. There are over 30 shows on that website that you can watch that are related to healthcare, including Mike Wilden's. Also, I want to remind you, if you go to the website, there are over 90 newsletters that you can take a look at that deal with stress, relationships, depression, anxiety. You can download these or share these with friends, and I hope they're helpful to you in your life. So now we want to get back with Mike Wilden. And Mike, you were sharing some really good news with us and some really good information. Would you just go ahead and pick right up and take off, please?
Okay, so again, I think what we were talking about is that the new opportunity for healthcare coverage for low-income Nevadans. So there are two opportunities. For people that have income below 138% of poverty, which, let me put that in real terms, if you're a single individual, that's about $15,800 a year in income. If you're a family of four, it's about $32,500 of income. So all of those individuals or families come next January of 14, they're going to be eligible for Medicaid, all comers. There have been various groups that we have covered and some that we have not covered in Nevada. So come January 14, all people under 138% of poverty will be eligible for Nevada Medicaid. So we think we're going to enroll about 146,000 more individuals, more Nevadans into that health care coverage option. Then people that have income over 138% of poverty, the legislature and Governor Sandoval have approved a process implementing the Silver State Health Insurance Exchange. It's an insurance marketplace. It's a place where insurance can be bought and sold. And so what's going to happen is people that have income over 138 up to 400% of poverty, so take those numbers I gave you and multiply them times 4, they can purchase insurance with tax credit subsidies through the exchange. And so the theory, the goal is that health care is much more affordable. So between the Medicaid expansion and the Silver State Health Insurance Exchange, we think we're going to pull about half of those 600,000 uninsured Nevadans off the uninsured status into insured status, and that gives them access, we hope, to quality health care, and we will be emphasizing preventive and primary care, getting out in front of the healthcare issues that Nevadans have. And as you know, we are not one of the best states in the nation with our health status.
Not so far, but maybe that's changing. Can you talk a little bit about what you were just talking about, Mike, about preventive health care and some emphasis with that?
Well, obviously what we don't want happening in any healthcare system is for people waiting till they have to go to an emergency room or hospitalization. There are a lot of chronic disease and people with, hate to get too technical, co-occurring disorders and things like that, that if you don't take care of yourself up front, that you don't do the things that you need to do early in your healthcare experience, then it's going to be worse for you and it's going to be more costly to the healthcare system. So we emphasize preventative care. So preventative care is as simple as get your children immunized, get a flu shot. Those are preventative kinds of things, the health awareness kinds of things. Primary care is if you're feeling bad, get into a primary care physician, go to a health clinic, go to someplace where you can get an early diagnosis, early labs, early screening of the issue, not waiting until you're on a full roll with a healthcare need and you're going to be in an ER, the most expensive healthcare system in the nation.
Sure, yeah. Mike, we have about a half a minute, and I was wondering, what else would you want to mention in this brief period of time that people can look forward to in 2013 or 2014 with the changes that you're making?
Well, the big thing to pay attention to is the outreach effort that's going to be going on. The state is contracting with organizations to help people navigate to get to these healthcare resources, the Medicaid expansion, the Silver State Health Insurance Exchange. So there will be navigators, outreach coordinators. We're going to be contacting every community organization, church group, those kinds of things, getting information out there so people will know the availability of this huge monumental change. First time in the nation, clearly first time in Nevada.
Yeah. That is some great news, and we'll return talking with Mike Wilden right after this brief break. Hello, and welcome back to New Skills for Living. We're talking with Mike Wilden, who is the director of the State of Nevada's Department of Health and Human Services. And Mike, it's obvious as you talk about this that you care very much about Nevadans and you're very passionate about health care. Can you tell us, what are the things that you're most proud of about what the Department of Human Services has accomplished?
Well, Tom, there's a lot of things, and as you said in my lead-in, I've been employed in the department for nearly 40 years. I started out as a case manager, now the director. So I've been around a long time, I guess is what I'm saying. The things I'm probably the proudest about is first our workforce. I mean, there's a very caring 5,000 people at the Department of Health and Human Services that provide all kinds of services. You mentioned 6 or 7 major divisions, agencies we run, but that's hundreds of programs. And it's a very caring crew. The last 4 years, when the state of Nevada has gone through a very tough economic times, and it's been called the Great Depression, not just Nevada, but the nation has gone through these tough times. And so caseloads increased, more people were in need, waiting lists had to be created because there weren't the resources. Well, the proud thing that makes me feel good, staff step up, community volunteers step up. They really try to pull together and at least do the best you can with the resources you have. And now, I mean, that pays off. We're coming out of those tough times. We're going into a recovery phase in the economy, and so we're going to start prioritizing and targeting some of the things that that we need to get done that have had to be sort of put on hold
they sure have,
for the last couple of years. So that's good. And Nevadans can be proud of a lot of things. We have state-of-the-art mental health facilities in the state. The Deanie Townsend Hospital here is a state-of-the-art facility, underutilized but state-of-the-art. We have a complementary hospital down south. We have very good community-based programs. We have kept nursing home beds or people in nursing homes flat over the last 6 or 7 years while we built programs to keep people living, aging, performing in the community. So those are things I'm proud of. Those are things that we try to do the right thing to keep people in getting the services that they need and that they want.
Can you talk a little bit, Mike, this concept about the social safety net and how important that is?
Well, a social safety net is absolutely important, and I'll say it's just not the state that is the social safety net. I mean, the state runs, like I said, $7.4 billion worth of programs, but we have county partners that we rely and trust and work upon, and then the nonprofits in the community. I mean, there are a score of nonprofits that we partner with. So the safety net isn't a single organization. It's not a single individual or a single program. It's really that woven fabric of programs that we do. The state can't be all things to all people. The counties don't have enough resources. The nonprofits are obviously underfunded at some point in time. So we have a philosophy that we try to push as much money out into the community as we can, and then the state provides, the ultimate, particularly like with healthcare and some of those kinds of things. But Nevada, again, is not known to be a good, a robust funder of social services programs, but I think we do well with the resources we have.
Mike, before we started the show, you seemed very proud and very excited about the what may be happening with suicide prevention in the state. Would you want to talk a little bit about that?
Yeah, as your listeners probably know, Nevada ranks, depending on what ranking you want to look at, third or fourth highest suicide rate in the nation. And so that's very disturbing to us. And Misty Vaughn Allen is our statewide suicide coordinator. She works very hard at that. We run that out of the director's office, the suicide prevention and coordination office. We're trying to integrate that going forward into our public health arena. We want it to be embedded in all of our public health messages. You know, public health is about population-based health versus a specific illness or disease.
Yes.
And so we really want to get that integrated in public health. We're adding some additional funding to stabilize that office, to keep the staff engaged and employed, and they don't have to search for grants all the time. And more importantly, we're running a piece of legislation. We worked with the First Lady, Mrs. Sandoval, on establishing death review teams associated to suicide. We do child fatality review teams in our child welfare business, but we really haven't done a fatality review related to suicide. So we're excited about that legislation, hope it passes, and we believe that will help make some systemic changes as we analyze those over time.
So that we might reduce the rate of suicide.
Absolutely. The goal is that we wouldn't be one of the highest states in the nation with suicide, that we could lower our suicide rate. That's a difficult subject to talk about. People don't like to talk about suicide. They don't like to talk about mental health, but we need to talk about that, and we need to find solutions.
Yes, Mike, and I appreciate you doing that here on the show very much. Thank you for doing that. So we're going to take a brief break, and then we'll get to our fourth segment and continue with Director Mike Wilden. Welcome back to New Skills for Living. We're talking with Mike Wilden. Mike, you were talking earlier about the outreach and how healthcare is going to be available to more people, and the state of Nevada is going to be very assertive in getting out and letting people know these services are now available to you and how to access them. Can you tell us more about what services we can expect to see?
Well, we've talked again a lot about healthcare coverage and some about behavioral health, so maybe I try to go to a couple of other ends of the spectrum.
Okay.
Well, let's talk a little bit about the senior and disability spectrum for a minute. One of the things we are doing is reorganizing some of our services in our senior and disability services. So we're moving that lifespan of services under one umbrella, one agency, so people don't have to ping pong and go to different organizations to get services. So we think that's important. And another important piece in that is dental care. And so one of the things, we get tobacco settlement funding in Nevada. Many states in the nation get tobacco settlement funding. And some of that money has been used in the past for a senior pharmacy program and a senior disabled program. When they can't find another pharmacy, we can get their meds through the senior and disability RX programs. Well, because of the implementation of the Affordable Care Act, that money isn't needed as much for pharmacy, and so we're repackaging those savings. And we've just are starting a senior and disability RX, a senior and disability dental program. So we expect to be able to pull in about 1,100 seniors and disabled individuals into the program over the next coming months, and provide them with a dental package where they can go in. It's not going to be robust. We're thinking it'll be about $1,000 worth of dental care per individual, but it's a good start, and it's an important direction to go. So that's something new for the seniors and the disabled. On the other end, we have responsibility to our youngsters. We run a program called the Nevada Early Intervention Services. These are children birth to age 3 that have developmental delays. It takes a lot of money to fund those kinds of services. And we've had trouble with waiting lists and keeping all the kids in service. And that's a critical time. I mean, when a kid's growing in that period of time, you've got to be on their service needs quickly. It's not like you can wait months to do things. And so the governor and our budget has invested substantial money into that. We're going to improve the early intervention services program. We're going to, we believe we have it funded, and this is several million dollars worth of funding that we believe we can pull all kids off the waiting list, about 340 kids statewide, and we believe we can also accept a new caseload growth thing. So we want it to be so that all kids age 0 to 3 with developmental delays, when they're identified, and they get an individual family support program planned together that they can get into services timely, and that we don't have to wait list kids. And so that's going to be a big deal for us going forward. Again, a tremendous amount of resources put into that.
Oh yeah, that's some really good news, Mike. Now, one of the things that I've heard you mention on one hand is being supportive of people, and on the other hand also though being very empowering and wanting people to be responsible for their health care. And I would imagine as you're looking at designing and implementing these programs, you're wanting to balance both of those things, kind of like that saying that says you alone can do it, but you don't have to do it alone. Can you tell us a little bit about how you and your staff and maybe the legislator and the governor are kind of balancing out those two concepts here in Nevada?
Well, I think the best thing to say that is we believe that people should be able to function at their highest level of self-sufficiency. That doesn't mean the same thing for everybody.
Yes.
You know, some people it's just a tune-up. You get them back into the workforce and they can go back and provide for their family or do whatever.
Yeah.
A disabled individual may need something more. You know, I mean, it's not just getting back to the workforce. They may need home adaptations, things like that. Someone with cognitive issues, you know, there's a different level. So it's the highest level of self-sufficiency that we can provide for anybody.
Yes.
And again, there's a personal responsibility piece, you know.
Yes.
The clients are expected to help along with that progress. So, yes, that is a core philosophy, and I've said earlier, we really push community programs. That's really what it's about. We would prefer not to have our institutional-based programs. I mean, there's a need for those. You know, some people can't function in the community, but we really do try to target our dollars on that path to as much self-sufficiency as we can get somebody as quickly as we can.
Yes. Mike, we have about 30 seconds right now, and I was wondering, for people that are out there watching and they're hearing your excitement and your passion for quality health care for all of us here in Nevada, what would you like to say just in like 15 or 20 seconds to us about what you see the future looking like?
Well, I think the future's good. I think we're on the point to recovery, but, you know, again, you know, the legislature and the governor doesn't always like to hear from bureaucrats like me. You know, I mean, I think it's important to be engaged, to advocate for what you think is important, so you can help that process through the legislative process, show up at hearings, put something on the record about what you think, or write to your legislator or the governor and support what you think is important.
Yes. So thanks to Director Wilden for joining our show, and as he said, be active and call your legislature and let them know what you think and what you'd like to see. Director Wilden, thank you so much for joining us. It was a real pleasure to have you here, Mike.
Thank you.